Well, good morning, everyone. We're going to go ahead and get started. On behalf of Flagler Cares and One Voice for Volusia, we'd like to welcome you to the 2021 Health and Human Services Summit. My name is Tracy Romius, and I will be the moderator for this session. You have joined the session titled SOAR for Disability Claims, and all of our participants will be muted during the session. There will be time later for question and answers at the end of the session. You can raise your hand at the end, or you can type it in the chat, type your questions in the chat. You may also submit questions, like I said, in the chat box, and we will answer them if time allows. We would like to thank our sponsors who have made this event possible: Advent Health, Career Source, Flagler Volusia, SMA Healthcare, Magellan Complete Care, Department of Children and Families, and the House Next Door. And it is my pleasure to introduce your trainer for this session, Ms. DeAnna OFlaherty.
Thank you, Tracy. Good morning, everybody. I hope everyone's first session was excellent. I got to sit on a couple this morning, and they're just really good information about the continuum of care and some information about DCF, which was really interesting. So I hope some of you got to go to those sessions as well. Like Tracy said, we will have time for questions at the end. I'm excited that people have come out to see some information about the SOAR program. So I'll start with who I am. So I am the SOAR processor for Flagler Cares, and I'm project director here at Flagler Cares. And I am SOAR certified, which means that I process SOAR applications for clients that are homeless or in danger of becoming homeless. I'm a SOAR supervisor, which means I supervise other SOAR processors at Flagler Cares, which is an honor because most organizations that have a SOAR processor have exactly one. And so there are lots of one-man bands. And so we'll learn a little bit today about how we support those SOAR processors. Secondly, I am also the SOAR local lead. So I help train other SOAR professionals in my geographic area, which covers Volusia, Flagler, and St. Johns counties. So that means that I act as a resource for every SOAR processor, regardless of how they are funded or what organization they work for. And I also happen to be a HUD certified housing counselor. So that really helps in bringing our clients through SOAR to get income and then helping them through the housing process, which we always hope we can help them with at the end of the SOAR process. So I welcome all of you and thank you for coming today. So what is SOAR? So you got excited when you saw it on the agenda. And so what does it mean? So SOAR is an acronym inside an acronym. So it is the SSI Outreach, Access, and Recovery Program. So SOAR programs increase the access to disability benefits for eligible adults who are experiencing or at risk for homelessness, that have a serious mental illness, a medical impairment, or have co-occurring substance abuse disorders. As you can imagine, people who come to the SOAR program who are experiencing homelessness, who are at risk for homelessness, and who have mental illness, medical illnesses, substance abuse disorders, that those things are occurring together a lot of the time. It's rarely just one and done. The SOAR model differs a little bit from a person simply applying on their own. In that, we do what's called a medical summary report. So that is a book report about our client. So we help the client apply to disability, and during that process, we request all of their medical records. We review those medical records and we write that medical summary report. And what that does is gives a narrative to disability and Social Security that says this person was a fully functioning, working person at some time during their career, and now they are not able to function in the same way. They have limitations to their ability to work. And we spell that out very clearly for DDS using the definitions that Social Security lays out. So what does a SOAR processor do? A SOAR processor is trained to assist clients who are homeless or at risk for becoming homeless to complete the screening and application process for Social Security benefits. So if anybody has ever applied for disability benefits or applied with a client, you know how difficult it is. It's a lot of moving parts. And one of the biggest problems with the process is almost everything is done in the mail. So imagine you're homeless, you're living in a tent, and you get on the phone and you apply to disability. You think, wow, I've really done something today. I've applied for my disability benefit. And then you find out that everything, absolutely everything, comes in the mail. Well, how would you do that? So a SOAR processor also functions as a mail drop, a place for clients to use to have their mail sent either to them or to have a duplicate copy each time sent to their SOAR processor. This lets the SOAR processor hold on to the file the entire time that it is in process with disability. And that's really important because timely response to disability when they ask questions is so important, and making sure that a client understands what's being asked so they can answer it effectively. A person as a SOAR processor, you can find that person through SOAR programs, and we're going to have a slide in a minute with some of those in our area. Clients come to us through professional services like their doctor's office. Many doctor's offices in the Flagler and Volusia area are aware of SOAR programs. They refer clients that they found are struggling with disability but have not been able to get benefits. They also can self-refer. So SOAR is a no wrong door program. Someone can come to us simply by calling us and saying, I think I qualify for disability, or do you think I qualify for disability? We do those screenings by phone and in the field. Even before the COVID pandemic began, we tried to really serve homeless clients and at-risk clients where they already are. So where are they? They're in the woods. They're in the parking lot of restaurants and professional businesses. They're at the doctor. We often go and sit next to clients in the doctor's office and help them fill in paperwork for Social Security and disability because they're already there. And transportation is an issue, especially in Flagler County, a little less so in Volusia, but when you have no income, it can be very difficult to access those things. So we do a lot of our screening by phone. And so when a client calls a SOAR screener, they're scheduled for a call within just a few days to go over their case. And then they are met out in the field to look at the paperwork and help them get started. And they can come to a SOAR counselor and a SOAR processor anytime during that process. So we get people who have never applied. We get people who've been denied recently, been denied a year ago, and sometimes even clients who are a little farther along in the process. And we'll talk about that a little bit in a minute too. So what is homeless? So if you work in social services, you're aware that homeless has a lot of definitions. So different programs define homelessness differently. For most SOAR programs, they use the definition of homelessness that meets the HUD definition. So that's an individual or family that lacks a regular, fixed nighttime residence, or who has a primary nighttime residence in a public place, or a place not meant for habitation. I have clients that live in tents. I have clients who live in RVs. I have clients who live in disused camped equipment that is in an area where they cannot access water or sewer. I have clients who are living with family members, or they're living in an institution or a shelter. So a person who is doubled up, that is living with family members or in a hotel, don't technically meet the definition for the HUD definition of homelessness. But be aware that while many SOAR programs follow this definition, They also have flexibility in the SOAR program because we also have a category at risk for homelessness. So I can always advocate that if someone is in a shelter or living with a person that is not a good situation, where they don't have any right to be there, they're doubled up, or they're in a hotel, that they're at risk for homelessness. Even someone living with a parent. I have several clients who are at risk for homelessness because they live with an elderly parent on that elderly parent's income. And when that elderly parent passes away or goes to an assisted living or nursing home, they will lose their housing as well. And we see a lot of that in the Flagler County area. So I always want to say, if you want to know if a client is homeless, just have them call us and we'll help them through that process. You never want them to eliminate themselves from SOAR screening simply because of their housing situation. So what is the difference between SSI and SSDI? I will admit that before I became a SOAR processor about 2 years ago, I didn't know the difference. And I used them interchangeably. I sometimes still use them interchangeably without sort of thinking about my audience. So SSI, the way you can help yourself remember it is it's an indigency program. So I for indigent. That's based on need. It's for people who cannot work, they're disabled, and they've never worked enough to be granted SSDI. The maximum amount of SSI benefits today, as it stands for 2021, is $794 a month. So if you have a client that gets $794 a month exactly, and they don't know if they get SSI or SSDI, now you know they get SSI. So one of the questions I get all the time is, I have a client on SSI who gets less than $794 a month. Why is this? That's an excellent question. If a client is paying back child support, or if they're paying back a previous overpayment, their SSI amount may be lower. If they are receiving exactly $529 a month, that's a little clue that they had a previous housing situation. So when you apply to disability, they ask you a question on your application. They ask you, what is your housing situation? And if you tell them that you're in a unit with your parents, they'll ask, are you responsible for the rent? Most people would say, no, I have no income. I can't be responsible for the rent. But when they're awarded benefits, that means they only receive $529 for 2021 instead of $794 because they do not have a housing cost. So that can be corrected after award. So if you have a client who's getting exactly $529, that's because of their previous housing situation. If they are homeless now, or they are paying for their housing now, or they're living with someone where they weren't paying housing before, but now if they were getting $794 a month, that person would definitely want them to start paying for housing. Then they can contact a SOAR processor and we can help them get that raised up to the $794 where it belongs. So what is SSDI? So SSDI is an insurance program. And the way I help people remember it is DI stands for Did I Work? So it is for people who worked and have at least 40 credits in the SSDI system during their working life. The amount that they typically receive upon award for disability is higher usually than SSI because it's based on their earnings. So that might be $1,300 a month, $1,100 a month. And so that is a little bit different. If somebody's receiving higher than $794, then you can almost guarantee that they are receiving SSDI benefits because they were actually paying into insurance. So when we're working, we are paying into an insurance plan with Social Security disability when we pay our Social Security from our wages. So most people don't realize that they're paying into that program. And when you cannot work anymore and you're deemed disabled, you receive income from that program. It's a little better than SSI in that it's higher, and it's not asset limited. SSI does not allow you to have assets above $2,000 a month, because remember, it's an indigency program. SSDI, you can have all of the other residual assets, and you can have income from other sources. So even if you're receiving benefits, say from the VA or from a pension from your previous employer before you were disabled, you can still receive SSDI. That is not typically true of SSI because you have to demonstrate need. So can someone qualify for SSI and SSDI at the same time? Yes. If a person has enough credit to qualify for SSDI, but is currently indigent, they have no income and no assets, they will be considered for both programs at the same time. This can lead to a lot of confusion during the process of application. That's why a SOAR processor is so helpful, because they're going to get letters from both programs at the same time, and they're going to be very confusing. They're even confusing to me. So we try to help clients to really understand what they mean. So what does disability mean to Social Security? So Social Security determines a person to be disabled when they have a physical illness or a mental illness, and they are counted equally. PTSD is examined in the same way as a leg amputation. Clients often think, well, I'm pretty sick with asthma, and my PTSD makes me so anxious, and I'm afraid I'm going to have an asthma attack that I can't go to work or go to an interview. I get so scared. But they only want to talk to me about the asthma because there's tests for that. Well, the PTSD matters just as much. And we want to talk to them about that as well and give them good recommendations for gathering those mental tests. Those mental tests, the same as medical tests. So they have to be able to prove through medical documentation that their disorder has lasted for 1 year already, or will likely last for 1 year into the future, and that it severely impairs their ability to earn more than $1,310 per month. So this number is called SGA. That's substantive gainful activity. That's another acronym that means, can you work? So people work and earn even while they're applying for disability. I tell clients all the time, work is never the wrong answer. So it's okay to work when you're seeking disability, as long as you're earning less than $1,310 gross per month. So someone working part-time, trying to continue what Social Security calls work attempt, that's good. Social Security wants to see that. And we'll help them manage their award along with their income. So my client had her leg amputated, but continues to work in a call center earning $2,000 per month. Is she disabled by Social Security entitlement? No. She has a documented medical impairment, but is still earning above the allowed amount. So she might need vocational support. She might need to look at her options going in the future. She might need to know all the resources she would have if she had a recurrence of the illness that caused her amputation and she couldn't work anymore. We would want to talk to her and give her her options going forward. But at this time, she is disabled likely, but not by disability standards, not by Social Security's rules. How long does disability take? So I'm sure many of you have heard, disability takes 2 years. You have to apply 3 times. I hear this all the time. So it takes 1 to 3 months for a SOAR processor to gather all the medical records needed to complete an accurate claim. Social Security takes a few weeks after the claim is filed to prepare the entitlement, which is when they tell the client whether it was SSI or SSDI or both, and then it's transferred to DDS. So one of the kind of behind the curtain processes at Social Security is that we all think we apply to disability through Social Security, and in some ways we do, but in other ways, the file is only at Social Security for a few short days or weeks. They just decide which train you're on. Are you an SSI or an SSDI claim? Then they transfer your file to DDS. And DDS is a private arm of Florida Health that is an entity that determines medically if you're disabled. Social Security doesn't make medical determinations, DDS does. So we work with DDS to gather all your medical records, summarize them, and present your case to DDS. A homeless client is flagged in the system, which means they go faster. So if someone is literally homeless through the HUD definition, then they get flagged in the system. When they reach DDS a few weeks into the program, they get assigned immediately. The Monday after they are received, they go to a DDS examiner. Unfortunately, someone who is not literally homeless might still qualify for SOAR. They'll still get assistance, but when their file goes to DDS, it'll go with about 60 or 90 days that it will wait for a DDS examiner. But if they're part of a SOAR processors program, then SOAR completes all their medical records and double checks that they're all there and that they've all been received. By the time they reach an examiner, their file is complete and ready for DDS to do their part. After assignment, the files can move very quickly, and a decision is usually made within 90 days of assignment. The total screening to award is around 12 months. People are surprised to know that after award is one of the longest processes. When we find out someone's been awarded disability, we do a really excited dance, but we know we're still about 3 months away from the end of our relationship with the client, because we still have to help them get their award, establish their bank account, get their Medicaid or Medicare, and work through that process. So why use a SOAR process? Well, they're really smart, I can tell you that. They're really knowledgeable. They work really hard, but we like data too. So the data is about 65% of initial SOAR applications are approved for disability. Excuse me. And the average back pay for a person going through a SOAR process is around $6,800. So imagine what that does in the life of a homeless person. Back pay is based on how quickly you got them their benefit. So our back pay is actually a little bit lower than that of a person who goes through an attorney and has to go all the way to appeal. Such a painful process. They lose about a third of their benefit to the attorney, and the attorneys tend to drag it out a long time just by the function of how their processes work. And that means they may get a higher back pay, but part of that will go to attorneys. Clients do not need an attorney in the initial and reconsideration phases of SOAR, of Social Security disability. They will absolutely need one if they go to appeal, as that's a legal process. So where can you find a SOAR program? I know that as you've been listening today, you've gotten so excited and thought about clients that really will need a SOAR processor in the future. So in Flagler County, you can find me. So my screening number is right at the bottom of the screen. You can also find a SOAR person in Volusia County with Flagler Cares in partnership with Advent Health. You can find a SOAR processor at SMA. So SMA has a SOAR processor through their program, through their mental health program. At First Step Shelter in Volusia County, they have a great SOAR processor there, Daniel, and some other ladies there that are doing SOAR processing for people who are in the shelter. So that's very exciting. At the Volusia Flagler County Coalition for the Homeless, they have a SOAR person there. And at Community Legal Services of Mid-Florida, they have a SOAR person there in Volusia County, and they can sometimes help with appeals. SOAR processors do not typically do appeals, but sometimes legal agencies will help with that. So that is where you can find a SOAR person. And we do our SOAR screenings right over the phone, like I said at the beginning. And you can send a client, you can send them to me by emailing me. You can call me and say, hey, DeAnna, let me ask you about this client. Or you can say to the client, call DeAnna, she'll screen you for disability. Because we use a no wrong door policy. So as people come to us, if they're not eligible for SOAR, we give them resources in Volusia and Flagler County for the programs they can qualify for or that may be able to help them. So what are some typical questions I get? I'm going to go through just a few, and then if you have questions, you can raise your hand by using the reactions button at the bottom of your screen, or you can type right in the chat, and Tracy and I will help answer those questions at the end. We just have a few slides to go. So go ahead and raise your hand if you'd like to do that at the end, or type in the chat box. Will the client get Medicaid or Medicare if they get disability benefits? Yes. When a person is awarded SSI based on being indigent, they will also be awarded Medicaid benefits. That is immediate upon approval. Oftentimes, I get their Medicaid approval before I get their disability approval. So it's a little clue to me that they've been approved, because Medicaid is really quick in getting those documents out to the approved clients. A person awarded SSDI, because it's based on insurance, they'll be awarded Medicare, and that's 2 years, 24 months, after the date that their disability began, not the date they were awarded. So I have a client who was awarded in December of last year, she was awarded, in February of 2021. They determined her disability began in December of 2019. So she'll be awarded Medicare in 2021, in December of 2021. Therefore, establishing the correct date of onset is so important. That's something we really help clients with. When they call disability and apply over the phone, which anyone can do, they often give them the wrong date. They say, oh, I've been sick since February. When I go back and get their medical records, their problems actually started months or years before, when they started working fewer hours or taking different kinds of jobs that earned less because they needed to do less work because of their disability. My client told me she is physically disabled, but that she can't get either SSI or SSDI. Is that possible? Yes, it is rare, but it happens. When a person is married, their household income could disqualify them for SSI, because they have to prove need. So if their household has income above the limit, they have to have low enough income to qualify for SSI and a long enough work history to qualify for SSDI. So I had a client a few years ago that she stayed home and took care of her children, and she ran the business with her husband, but she wasn't a paid employee. And then she got very sick. They still had some income from the business, though a lot less, because she couldn't work there anymore. But it was enough to knock her off of the SSI train, and she didn't have any credits for the SSDI train. So she actually could not qualify, and even though she was completely disabled. So that does happen, and we can help your clients to unpick that knot and kind of decide what options they have going forward. My client has SSI, but his payment stopped, and he does not know why. So we hear this a lot, especially among indigent, homeless, or clients who are in danger of becoming homeless. They lose track of their SSI. They know when it's going into their account, and they hope it'll continue without any intervention. But occasionally it'll be stopped for the fact that they have been, Social Security has been unable to locate them. And so just giving Social Security a call, letting them know, we get on a conference call with them. We can conference call Social Security all day, every day. So if a client calls us, we can put them right on a conference call Social Security. And we talk to a live human being every day, and we'll help them to fix that. So a young lady called me. She said, I'm not getting my disability check. We called disability and said she's not missing. She moved from her other state to Florida. She is living in a tent. We do use our office address. She's able to get documents at our address. We talked to her along with Social Security for about 15 minutes. And within 3 or 4 days, she had her benefits into her account. It's very quick to restore benefits when it's for a failure to locate. Sometimes people lose their benefits for failure to report income. And so we can help with that. Sometimes it's because something is wrong or incorrect in their file, or their living situation has changed. We can absolutely help them with restarting their benefits. Sometimes they've been incarcerated or in a shelter or in an institution and they need some help getting restarted. And their SOAR processor can help with that too. My client got a letter saying he's denied just a few days after he applied. Can he be denied so quickly? Well, yes and no. So we said before, you have to qualify for SSI or SSDI. Well, when you apply through SOAR or on your own, they put you on both trains. They give you a ticket to both. But pretty soon, you get thrown off one of the trains, usually. And so most people don't qualify under both. So they'll get a letter saying you've been denied. It's a denial for entitlement to one of those programs. We always tell our clients, denial is slow. So real denial takes months. And so if they get a denial quickly, they can call us and we'll go over it with them to let them know what that actually means. Usually it means you didn't get SSI or you didn't get SSDI and your other train is chugging forward. My client got approved for benefits with back pay, but only some of the back pay was deposited. So this can be very unnerving. So a client brings you in a letter for benefits and you're excited to help them to enroll in your program. And it says they'll get $6,209 in back pay and you're excited for them. And then the first check goes in and it's for $2,382. That's because of the asset limit in SSI. So in SSI, they can only receive that $2,382. Then 6 months later, they'll receive it again. If that does not exhaust what they're owed, they'll receive the rest one more time usually. If it's SSDI, remember SSDI, did I work, has no asset limit, and all back pay for SSDI can be paid when they're awarded. So which program they're on matters a great deal. My client is disabled by his chronic back pain, but never goes to the doctor for any treatment. Can SOAR help him? Yes. A SOAR processor will help him get started in treatment and give him good information about treatment. I have a client right now who has not a single medical record, but he has a long list of disabilities because he's indigent, homeless. He has a disorder that makes him quite paranoid and reticent to not receive treatment. So we still submit his file, but we help DDS to send him to DDS's doctor. This is not ideal. DDS's doctor is a quick one and done, and they work for DDS, but they're an alternative if someone has no medical records. And if someone is homeless, DDS will always pay for that appointment and provide them transportation by taxi to that appointment and back. So it's a good option. My family member never graduated from high school and can only find very low paying jobs. His epilepsy is well controlled on medication. Is he disabled? Not by disability standard, probably not. He has a vocational problem rather than a disability, an illness that can be disabling, but is not limiting his ability to work, does not qualify. He should seek vocational training. He can call a SOAR counselor, a SOAR processor. They'll help him to figure out what the requirements for disability are and why it's not a good path for him at this time. And it can often save someone from applying on their own only to provide all that documentation to find out that they're disqualified because they're not disabled. Their illness is well controlled on medication. So this time we're going to open it up to questions. I'm excited. Anybody raise their hand that would like to ask a question? You have a little button at the bottom of the screen that says reaction, and you can raise your hand right there. Or if you're having a little trouble finding that, be sure to type into the chat box. And Tracy will unmute you.
DeAnna, someone said, can you please provide your email?
Absolutely. So my email, I'm going to type it in the chat here to everyone, is my name, DeAnna, at flaglercares.org. And I love answering questions. So if you have a question, you think, I don't know. Who would I ask? But it has the word Social Security in it. Disability, email me. I'm happy to answer your questions. And I get really good questions. And I get really good head scratchers sometimes. Because I am SOAR local lead, there are amazing resources out there for these strangeness that we encounter among our clients, and there really number of ways that disability can present itself. And they're very knowledgeable people at the state level, the federal level, in our region, and I participate in all of their case support programs. So if I get a really strange question, I have lots of people that I can pose it to that are more experienced than me and are even directly to disability. So one of the most exciting things about a SOAR program is they have a relationship directly with disability and with Social Security. So thank you for that question.
Don't see any hands raised.
Okay. Well, I'll ask a question if anybody wants to answer in the chat. Did you learn something today about SSI, SSDI that you did not know? So I'll watch the chat box. Excellent. Good, good. Thank you. Excellent. Anybody want to share what they learned in either the chat box, or we can unmute you? Thank you, Ms. Bishop, Ms. Celestin. Oh, they're all shy today, Tracy. Well, if we don't have any more questions, we're going to end our session. Tracy will give the shout out here at the end, and then let everyone out. So enjoy the keynote speaker for lunch. Mark said, I learned a lot. SOAR has grown in our community since I retired from HUM several years ago. Do you want to volunteer anywhere, Mark? I know a great SOAR program. So Kelsey said, I learned how long it takes to get approval and to have services set up. Excellent. Well, that is so exciting. So I'm going to turn it back over to Tracy, and thank you all for coming. I look forward to working with each one of you.
Thank you so much, DeAnna. That was wonderful. I just added the link in the chat for you to go back to navigate back to the event platform, Whova. And I just want to thank everyone for attending this session today. Please join us for the lunchtime keynote session. Like DeAnna mentioned, it's between 12 and 1. And like I said, the link to return back to the platform is there. Again, thank you everyone for joining us, and have a wonderful day. Bye.